Hello everyone. Today's video is about a treatment method that has been helpful for me to recover from sports injuries. As per usual, nothing that I'm saying should be construed as medical advice. This is for informational purposes only. If you need medical advice, please talk to your healthcare provider to get that advice. So I've posted about this in a few other videos before. Normally I talk about complex chronic illness, Lyme disease, mold toxicity, heavy metals, digestive disorders, etc., etc. Methylene blue is one of my favorite things to talk about. But from time to time I talk about things that I found to be helpful for me to help reduce aches and pains, recover from injuries faster, etc. So I thought I'd do a little update video on that because of some events that transpired in my own life within the past few weeks, and I thought it'd be interesting for a video. So I lift weights a couple of times a week. I do some cardio a couple times a week. I do jujitsu and MMA classes a couple of times a week, or a few times a week. And I'm in my early to mid 40s, depending on your perspective. So eat very well. Generally take very good care of myself. Don't get enough sleep because I have too many projects on the go, too many children, and too many patients. But outside of the sleep aspect of things, and maybe a little more stress than would be ideal, otherwise, like diet-wise, exercise-wise, take very good care of myself. So that is the backdrop. However, despite all of that, and I'll blame some of it on like past injuries and some of it on just advancing age. I like to think I'm still not old, but all of my excessive gray hair does maybe belie that a little bit. I do get some injuries from time to time. When I'm sparring or rolling with fellow classmates in my classes that are half my age and in much better shape than me. It can take a little bit of a toll. And so I had this my right shoulder was squawking at me a bit. I was doing bench presses. I'd feel it kind of pulling a little bit. Just, I'd adjust my technique a bit so I didn't have to ever stop lifting weights because goodness knows I'm not going to take a rest day. That's just not really in my blood. Or a rest week or whatnot. It's not really in my blood. My shoulder was kind of squawking at me a bit, and then my right forearm was squawking at me a bit as well. I was like noticing that with bicep curls, and I was doing some rehabilitation exercises, doing some physio exercises at home. Kind of getting things, things were moving in the right direction, but they're still just kind of bothering me. And so I thought to myself, well, I should really just smarten up and ask one of my colleagues to do some prolozone injections on me. Prolozone is a treatment. It's an injection therapy. It involves injecting a combination of prolotherapy solution, which there are different prolotherapy solutions out there, prolo being a short form for proliferative, or sort of a derivative of that word. So the prolotherapy solutions we use here at the clinic are a combination of D50W, which is 50% dextrose in water, and procaine, so locally acting anesthetic. And then we combine that with ozone, because ozone also has tissue healing properties. Taking a step back, prolotherapy has tissue healing properties by helping to stimulate the release of growth factors and anti-inflammatory factors and analgesic/pain relieving factors at the sites where the injections are done. Ozone therapy does all of those things as well, so the two together are very complementary, and together prolotherapy plus ozone therapy is known as prolozone therapy. So I asked one of my colleagues to do some prolozone injections on my shoulder and on my forearm, and did that before the start of my day. And she did that. I said thank you, and we just went off on my merry way and didn't really think much of it because I'm always running around like a headless chicken with too many projects and patients and all of that. Maybe not a headless chicken. I do use my brain throughout the day, but a very busy chicken, shall we say. A week ago, these injections were done about 3 weeks ago. So about a week ago, I was lifting weights in my garage, and my free weights. It's not fancy, but gets the job done. So lifting weights out in the garage, and I was like, man, oh man, like my right shoulder just feels awesome. I had no pain, no twinging, nothing like that. It's like, this hasn't felt this good, and like I can't remember the last time I felt this good. And I was like, oh yeah, right, I had those prolozone injections. And then I do a split weightlifting regime. So I do half my muscle groups one day of the week, half the other day of the week. So a few days later, I was doing my bicep curls, and like, wow, like I don't feel any pain whatsoever in my forearms. Like, this is amazing. And I was like, oh yeah, I had those injections done. So it was kind of this, one of the fringe benefits of being very busy and having maybe too much on the go, arguably, is that it was almost like it was almost like I was controlling for the placebo effect because I, completely forgot. Like I just wasn't thinking at all about like, oh yeah, I had those injections done a few weeks ago. And as I was exercising, I was like, wow, like why was this feeling so good? Like, oh yeah, I had those injections. And usually with prolozone therapy, it takes about 2 to 3 weeks to start seeing the benefits. I mean, there are certainly, I'd say maybe 10 to 15% of cases we'll start to see some pain relieving effect within, like either immediately or like within 48 hours anyways of the injections. That does happen. Most cases we're going to start seeing the benefits within 2 to 3 weeks because it's not like a cortisone shot where we're injecting the cortisone. We expect the inflammation to just get obliterated and you're feeling better lickety split. That's a wonderful selling feature of cortisone. Now, of course, cortisone doesn't do anything to actually help rebuild or repair the tissue. So if there's a damaged ligament, damaged tendon, there's cartilage breakdown in a joint, cortisone can help to reduce the inflammation and thus the pain, but it's not going to do anything to actually try to rebuild the damaged tissue. That's the goal with these proliferative therapies like prolotherapy and ozone therapy, to try to actually heal up the damaged tissue. So it doesn't work overnight because, of course, it takes some time for the body to heal. And we're really just, when we're doing these injections, we're really just bringing the signal to the body to say, hey, heal this tissue, and then the body's going to heal as much as it's able to. So after that 2 to 3 weeks, 2 to 3 weeks after having those injections done, it's like I completely, just wasn't on my mind at all. I was like, wow, why is this feeling so good when I'm doing these exercises? So So anyways, I just wanted to share that little anecdote because it was a good thing that had happened in my life. And I've posted other videos about prolotherapy in the past. I've done, literally tens of thousands of injections with my patients over the course of time. It's something we do here at the clinic all the time. It can be very, very helpful. Certainly not a panacea. I mean, patients who have, say, bone-on-bone arthritis, that it can only do so much. Sometimes doesn't help those patients at all. Sometimes it does work very well. For someone who has like a completely torn, rotator cuff tendon or something like that, it's like it doesn't magically reattach, a torn tendon. But if there's, partial tears or there's, things that don't need to be surgically reattached, oftentimes prolozone therapy can be helpful. If you yourself are dealing with sports injuries, whether they're related to jujitsu or related to weightlifting or related to soccer or related to basketball or whatever it happens to be, if you're not aware of prolozone therapy or even just prolotherapy by itself or ozone therapy by itself, it is something worth asking your healthcare provider about to see if that's something they offer, or maybe it's something that's available in your community. Again, not indicated for every type of pain condition that's out there, but for in my experience, the vast majority of sports injuries, prolotherapy/prolozone therapy is something that could potentially be indicated. So worth asking about if it's something that you're struggling with. I know that it's in my experience where there are other middle-aged grapplers and folks in my MMA classes and folks that patients that I have that train as well. A lot of us who do martial arts, when we hit a certain vintage, it's kind of a running joke is that it's not if you have an area that's painful or sore, it's like which areas or how many are sore, or like how many sore areas do you accumulate over the course of time. And in all fairness, I'm not the best patient when it comes to being on top of that, like white on rice. I'll get an injury, something gets strained, something gets pulled, and it's like, I'll just I'll give it a little while, give it a couple of months. I'll just because I never want to take the time to get treatment done on myself. However, when I do get the treatment done on myself, it does really help. Prolozone therapy has been really helpful for my neck in the past, for my knee in the past. I had a wrist thing that was going on once upon a time that helped to rectify that, and now I can add shoulder and forearm to the list. So still lots of body parts that I haven't had prolozone, but over the course of time, because I don't plan to give up these hobbies anytime soon, I'm sure I'll get some other body parts injected eventually. But anyways, I hope this was of interest. If you enjoyed the video, please consider liking the video, share, subscribe, post a quick comment if you don't mind taking the time to do that. I really appreciate it. And any questions or comments on this topic, please just post in the comment section below, and I will do my best to answer as soon as I can.